Oh, okay. So we are recording also the
Right.
session. We will be recording it. We have
Perfect.
Hassan, we uh Mitalisha, and one will be myself, and other will be the EMED masters. So
Yeah.
let's start it. Can you see the screen I'm sharing?
Yes, please. Yes, I can see it perfectly. Thank you.
Uh-huh. Okay. So that's good. We will be talking about MRCS Part B clinical examination and the techniques for the exam. So
Okay.
as we know that for MRCS Part B exam, the eligibility criteria is the MRCS Part A, passing the MRCS Part A exam.
Mm.
So I hope you would have already done that, right?
Yeah, yeah, absolutely.
It is an intercollegiate exam, as we know that there are other colleges like Edinburgh, there is England, there is Glasgow and Ireland also, who are conducting the MRCS exam. Poll of all of these colleges is same, and most of the times even the faculty is same that conduct the exams for the
Mm-hmm.
Edinburgh or for the Ireland or for the England or for Glasgow also. So let's
Okay.
start with our part B journey. My name is Dr. Jamal Nasir. I am a general surgeon. I have done my MS in general surgery and I have done my MRCS from Edinburgh last year. So as I already said that it is an intercollegiate exam and basically it is based on the OSCE system of the examination, and it tests our anatomy, pathology. There are two portions, the knowledge and the skill portion. The knowledge will test anatomy and pathology and critical care, whereas the skill portion will cover all the surgical skill portions that we will discuss further on. Eligibility be passing the Part A exam. After the Part A exam, you book your Part B exam, and usually a good thing is that in Pakistan, Edinburgh is conducting the exam three times a year, in January, in May or April, and then in November and December. They are conducting the exams in Islamabad, in Lahore, and in Karachi. So
Gotcha.
it's three
Yeah.
times a year. And but the window, whenever the window open for booking the exam, it usually closes within a half an hour. So there is a lot of congestion in Pakistan regarding this exam. So you will have to be very aware if you want to give the exam in Pakistan. And I would suggest that if there is any possibility, you book the exam in your own country. It is always good because you don't have to go for the visa, you don't have to go for the hotel booking and all this hassle. So it is always good to have you the exam in your home country. Hello. I would
Yes, yes.
request the colleagues to kindly mute their mics until unless you want to ask something. It will be an interactive session, so we would try to be more interactive. Well, the exam pattern is, as I already said, that there are basically two set of uh, stations. One will be the knowledge, and the other one will be the surgical skills. So basically, there are it is composed of 19 stations. The two stations are preparatory or rest station, whereas the 17 stations are examination station. It is a very hectic exam, I would say. I have given my uh, training or specialization part two exams, but I would say that MRCSB exam is very hectic. It is uh, it is very difficult and not difficult, but it is very hectic exam. The exam duration is almost 3.5 hours. It is basically they divide it into two portions. There are first set of stations, and then there is a small gap or a break within, and after that they again start the other set of station. Each station, usually they allot you 10 minutes for each station. Like in this picture, it is like the OSCE exams in PLAB, in MRCS, in any other exam. the OSCE exams are almost similar. So you wait outside the room, the station, and there is 1 minute reading time. Uh, you will be given very clear instructions regarding the station. Like if it is anatomy station, there will be an instruction. If it is communication station, there will be instructions. So there will be 1 minute to read the question or the instructions, and then you enter the room, and then you have 9 minutes to execute the task. We will further discuss how they divide all these things. Each station consists of 20 marks. There are 8 applied knowledge stations, and they constitute the 160 marks: anatomy, pathology, and critical care. Similarly, the other skill station, they have 9 stations. So the skill stations have more stations than the knowledge stations. And the number of the skill station is also more than the knowledge station. It is 180. So 8 knowledge station that will have 160 marks, and 9 skill station that will have 180 marks. How do they divide the stations? As I already told you that there are 17 examination stations, there are the knowledge stations, and there are the knowledge stations, and there are applied skill stations. So the 8 knowledge stations are divided into anatomy stations, pathology stations, and critical care stations. And the applied skill, the 9 stations are divided into the history stations, the surgical skill station, yeah, procedure stations, physical examination stations, and communication stations. So we will further uh, go and review each of these stations, that what data we have, what we have to study, how we will have to attempt these stations. So we have the knowledge station. As we said, the 8 stations are the knowledge stations. There are 3 surgical anatomy stations. This is the part that is the important one. Anatomy is an important. All the 3 stations of anatomy are extremely important, because these are the stations that if you attempt it in a good way, you can get all marks. You can attempt all the questions out of it, and you can get a very good score with it. And then there comes the pathology station, that are the 2 stations. And then there come the critical care or surgical sciences station, that are 3 stations. So there are 3 anatomy stations, 3 critical care stations, and just 2 pathology stations. The anatomy stations are important because when you will start studying the knowledge portion, you will get to know that anatomy is a whole. There is a lot of data of the anatomy that you have to study, whether it is from the central nervous system, it is from the limbs, it's from abdomen and everything. You have to cram everything, and in these stations they can ask you anything. I will further go briefly tell you about the stations in anatomy, pathology, and critical care also. Then there comes the skill portion. We have 9 stations for the surgical skills portion. There are communication stations, history station, and then there come to communication stations, that patient relative, you have to communicate with patient or relative, then you have to communicate with another health professional. And there comes the procedure skill stations. There will be 3 physical examination stations and 2 procedural stations. We will further go in detail about each of these stations. If there is any kind of question, you can ask me. We mean to make it interactive. So let's yeah. Hello.
It's
Anyone
fine.
want to
There are no
ask
questions
anything?
for now from my
Okay,
side.
okay, okay.
Yeah, thank you.
Okay. So let's go into each of the stations, and let's discuss each of the station. So as
Okay.
I said that 3 stations are from anatomy, and they are the most important stations.
Yeah.
Basically, what happens is when you enter into the exam, uh, the adrenaline and the rush and everything is at its peak because it is
Mm.
a costly exam. It is very important exam, and you have spent a lot of time preparing for it. So uh, I passed my exam in Kuching in Malaysia. So what happened was that when the exam started, my first station was anatomy stations. And fortunately, my anatomy station went so well that my confidence boosted to the height, and I was
Mm.
so happy because my anatomy my first station of the anatomy went very well, and after that there was a procedural station that also went very well. So all these matters a lot, especially the anatomy, because you have to cram all the data in 2 or 3 months, and then you have to give your best in your examination. So there are three stations of the anatomy. In anatomy, what you will have to uh, cram and read very carefully is all these things. The spine, the spine, upper limb, upper limb constitute all these things. The shoulder, brachial plexus, arm, forearm, hand, anatomical snuff box. You will have to study all the nerves of the brachial plexus, all the muscles of the shoulder, hand, forearm, and their insertion, their function. Similarly, the landmarks of anatomical snuff box. Anything can come up. Basically, what happen is that when you enter into the station, they will they will give you the pictures. It may be cadaveric picture or it may be any other kind of picture. And basically, in the picture, they will ask you. It can be from the upper limb, it can be from the spine, it can be from head and neck, it can be from thorax or abdomen, and they will ask you what this structure is. I will explain a little bit in the upcoming slides also. Similarly, in lower limb, we have all these topics to study when we will start preparing for the exam. Pelvis, hip and thigh, popliteal fossa, femoral triangle, adductor canal, leg, ankle and foot, all the muscles, nerves, blood supply of these things. Similarly, the boundaries, anatomical boundaries, and even ligaments of the ankle and the foot are also important stations. Similarly, we have head and neck, and then abdomen and thorax. So this is what constitute the whole anatomy uh, portion of the MRCS Part B. And there are a lot of books. There is a lot of data. Our also we med masters, they also have data for the anatomy, and they cover all this. So as I already said that usually they will give you a picture like this, and they will ask you that what is the structure number 16, or what is the section number 25, and you have to answer it. There is like it is like a rapid fire. They will ask you first about the structure,
Yeah.
to identify the structure, and afterward
Mm.
they will ask you the questions regarding the structure, like its sensory supply, its motor supply, what muscles it supplies. So they will ask you all the things about the structure, and you have to
Mm.
answer this. And in one station, it is not like in one station they will give you just one picture. They can give you multiple pictures. Like
Mhm.
in my stations, when I was attempting the exam, in each station they would they would hand over three different pictures, printed cadaveric pictures, and in each picture there would be like 4 or 5 structures to identify. Like in this picture, the structure 16. What is the structure 16? What is the structure
Medium
25?
nerve,
They can ask you
ulnar
anything
nerve.
else also.
Yeah.
It is it is just to just to make you uh, aware of how it works. Similarly, in one of my exam, in one of my station, in the head and neck, the skull and head and neck station, this was the picture that they gave us. That what is the structure in yellow, what is the structure in red. Can you tell it, Hassan?
Yeah, I'm trying to figure out the one in yellow.
Yeah,
Yeah.
this was the exact picture. Would you believe?
Oh, it
This
is.
was the
It's
exact
very
picture
difficult. It
in
is
my
very
exam.
difficult. Well, I can identify. I can identify the midbrain. I can identify, and I think it's a retracted piece. I think there's this optic chiasma, optic nerves going on, maybe, and I cannot identify the yellow one. What is it?
Uh-huh. Any idea about the red one?
Red one is probably a sinus. Maybe a sinus.
No,
Yeah.
it's not a sinus. It is basically both of them are cranial nerves. Okay, both of them are cranial nerves. Then when you identify the
No,
nerve,
the
they will
red one
ask you
is
about
the
the
red one
about
pointing to the blue. Is the red one pointing to the blue structure or this elongated structure?
no 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 no, no, to this white structure that's coming from the
Oh,
vertebrae.
I see, I see, I
And
see. I
then
thought
should
it was
be
pointing to the blue thing. I thought it was pointing
no
to
no
the
no
blue.
no, no.
I see, I see, I see, I see. Yeah,
So the
then
yellow
both
one
of
is
these are cranial
slowly
nerves.
the
Both of
yellow
these are
one is
cranial nerves, absolutely.
ah,
Yeah, and
okay.
coming
Yeah,
out
both of
from
them are
the
cranial
midbrain,
nerve.
coming out from the midbrain, the number
Uh-huh.
three, the red one should be oculomotor, maybe,
Yeah, exactly.
if I'm not
very
wrong.
good,
Yeah.
Hassan. And the yellow
Um,
one is facial nerve,
and the yellow one
sixth nerve,
again is the
seventh
level of
nerve.
midbrain.
The
Trochlear?
the yellow the the yellow one is sixth cranial nerve.
So 3, 4, 6, yeah, abducent. Okay, okay, yes, 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 yes. All
Yeah.
right.
So
Agreed.
just to make you aware of how it works, as I
This
said
is a
that
very difficult
you
picture.
already
Honestly,
have
difficult picture.
already exactly this was one of the picture in my exam in one of the station, and this was the first one station that when I entered into the exam, they handed me over this, and the examiner was very like he had no expression on his face. He was from Edinburgh, and there was
Mhm.
no expression on his face, and he just asked me this that
Oh,
yeah, you identify this,
so I have
and
a
I was
question,
like
Dr. Jamal. I have a question. The image you showed to us previously, the hand one. So the we have all, I'm sure all of
yeah.
us have seen the image, and there are these markings. Yeah, this one. So they're actually there. Now it's say numbers
Mhm.
25, 28. Do they ask us about all of these things, or they can just ask about any two or three structures in this?
In each picture they ask you usually two three maximum two or three things.
Okay, okay,
Basically, this image is from one of the data that we uses to teach the students. So we mark each and everything, but usually
yeah,
it's not like that. It's not overburdened with the numbers or overburdened with the arrows.
okay,
Usually they give you like this. There will be one or two arrows or three arrows at maximum. They will ask you, and believe me, they usually ask the important things. They don't ask you the things like minor things. They ask you
yeah,
the important
yeah,
things, and they
yeah.
because each structure they will ask you further questions regarding that same structure. They will ask you
Mm,
the root. They will ask you the motor and sensory supply. They will ask you what muscles they supply. They will ask you
mm,
about the injury at the wrist or at the elbow.
mm.
These are the things that they will ask you. So
Perfect.
usually you have to know these things and you have to memorize these things. Similarly, the cranial nerves, cranial fossas, there are a lot of data that you have to memorize, but you have to read it again and again, practice it again and again.
Mm,
Similarly, another structure, like in one of the there are few things that you will get to know that it's their favorite. When you will revise the recalls, you will get to know that few stations are very important or very frequently repeated, like head and neck.
yeah,
They like a lot giving pictures of neck. They like a lot giving picture of cranial nerves. Similarly, they all of the Royal College like a lot giving the ligaments of the ankle or the foot.
yeah.
So like this, they will give you a one or one or two arrows that what this structure is, where it
Hmm.
supplies,
Hmm.
what is the function of this, like these things. So can you identify this one?
Greater auricular nerve, doctor.
Greater organ nerve, yeah.
Yeah, exactly, exactly. Okay. So this was all about the anatomy. Okay. So
Hmm.
have you
Okay.
got any question regarding the anatomy stations?
Yes, doctor. I'm Dr. Ashik. I just have a small doubt. So
Uh-huh.
when I was reading the anatomy stations, so I go through more notes. So I find the red colored dots or numbers encircled in red in the more notes. So that is important. So I should not miss them when I prepare.
Yeah, exactly. Like this one, like this structure.
Yes,
Look, there are
yes, yes, doctor.
there are a lot of structures, but basically the dotted or the circled ones are that they ask repeatedly in the previous exams.
Okay,
You will find some documents. You will find some documents about the recalls of the previous like 5 years or 10 years exam. As you know that Edinburgh is taking three exams in Pakistan. Similarly, they are taking all over the world. Similarly,
Yeah.
Ireland. Similarly, Glasgow. Similarly, England. They are taking a lot of exams. So what the students have done is, or the candidates have done is that they have combined somehow all the exams. And when you will see, then you will come to know that usually they ask about these important structures a lot, but you should not miss the other structures. You should have an idea about the other structures also.
all
You
right, doctor.
got
Thank
me?
you. Yes, doctor.
Yes. Also, one
Okay.
more question, Dr.
So,
Shmal.
so this was about the
On where,
yeah.
may I ask one? I have a question. On one
Uh-huh.
station, is it possible that they keep on, if they give you like they give you three pictures, a cadaveric
Uh-huh.
picture, the diagram, or a model picture, whatever? Is it going to be from the same station, from the same region, or they can give it from any other region? Like one picture could be hand, other could be the neck, and other could be the brain or abdomen, whatever.
No, usually what happens is that they like they will give you from the same station, from the same region. If they are
Okay.
testing your head and neck, they will
Yeah.
stay within these region. You
Okay.
will get to know when you will enter there, you will get to know that they are asking me about the lower limbs, they are asking me about head and neck, they are asking me about abdomen, they are asking me about upper limb. They will give you consecutively, they will give you the same the pictures regarding the same muscles or nerves, these kind of things.
Hmm.
So you will get to know when you of the exam, you will say that you will get to know that there was upper limb, there was head and neck, there was extraction from the lower limb or from the
Yeah.
foot or from the ankle usually.
Okay.
You got me? So basically what I want to tell you is that anatomy is very important to pass, and it is, and the good thing is that if you know it, you can score 100% in anatomy, because
Hmm.
there are patent questions they will ask you regarding the same structure, and if you know it, you can score 100 out of 100.
Hmm.
Like in pathology or in critical case, you might not remember the things, or you might not answer the thing that they want to ask you. But in anatomy, if you know the things, you can get easily 100 out of 100, and you can score very good in that. And the other important that I want to tell you is that you have to prepare anatomy throughout these 1 month or 2 months or 3 month course. It is not like you will leave the anatomy and you will
Hmm.
just give it 1 month, and after that you will not practice the anatomy. You have to practice the anatomy throughout every
Hmm.
day, at least 1 hour or 2 hour. You have to give it to anatomy and repeat it again and again, again and again. Are
Perfect.
we clear here?
Absolutely.
Okay. So let's go towards the another thing, the next one, pathology. So basically, pathology, we have the two stations from the pathology, and these are the most commonly tested topics of the pathology. You will wait outside the station. They will give you the clear instructions regarding a scenario, and you will get to know that this scenario is about the lung cancer, or this scenario is about the breast cancer, or it is about testicular teratoma, or it is about pathological fractures, or it is about hepatitis C, or it is about acute pancreatitis. When you will enter into the exam, they will ask you that have you read the instruction or you want to read it again. Then they will start asking you questions. Like if it is breast cancer, they will start asking you about the questions. They will, if it is usually within these are the most important topics that will come, and
Hmm.
these are the topics that come from. Yeah, the questions might change a little bit, but these are the topics that they test usually: malignant melanoma, skin diseases like basal cell carcinoma, malignant melanoma. Similarly, the malignancies, esophageal carcinoma. Most you can see in this list that there are like 7 or 8 malignancies. There are 3 4
Yeah,
topics
true.
from the
True.
skin diseases.
Nasopharyngeal, lung cancer, esophageal,
These
gastric.
are the
Yeah.
topics, and these are I think they combinedly these are 32 topics. So
Okay.
if you schedule the pathology like a daily 3 or 4 topics, so within 10 days you can easily revise it. And very good revision. You can give it a very good revision because few of these topics are very minor or very just 1 page or 2 page topics. These are not
True.
lengthy topics. Like Men 1, Men 2 syndrome. They are very small topics. You can
Yeah.
combine 4 or 5 topics with them. But some of them like infective endocarditis, temporal arteritis, similarly IBD, these are a little bit lengthy topics, and there are some difficult questions in them. So
Yeah.
you have to uh, cram them, know them, remember them, and believe me, they will ask you the same questions. They can just add 1 or 2 question, but the 90% of the questions will be the same question. So you can also score very good in pathology also. And again, if you schedule it in a very good way, like if you read 3 topics on daily basis, within 10 days you can revise the pathology. And then again, if you again schedule it within 4 or 5 days, you can again revise the whole pathology station. Are we clear?
Okay. Yeah, I have a question here. I have a question here.
Yeah, yeah, yeah.
So, like you told in the beginning, we have the instructions on the board, on the door, and then we can read the question again once we are with the examiner. Okay. So, I was told by somebody, and I have maybe read somewhere that in pathology they gave us histopathological slides and diagrams. How true
Uh-huh.
is that? Do we get
Well,
histology
usually,
diagrams?
usually no, 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 that's not true. That's not true at all. In That's not true at all. In pathology, they might like there are few topics where there are histological slides, like in malignant melanoma. Similarly, in I think basal cell carcinoma or in another malignancy, there is a slide, but
Yeah.
that's very few. That's These are very few topics, and the slides are very distinct slides. You will get to know it. So it's not like they will give you slide from outside these topics. They will give you the slide within these topics, and within these topics there are very few topics that have slides. Not every topic have slides. So
Okay.
in
And
histology,
what about the endoscopic pictures, like for
in
adenoma FAP or for
in
like pseudomembranous colitis? Can we get pictures from them, the endoscopic pictures as well?
Yeah, but these pictures are already repeated pictures. You will get the
Okay.
same.
Yes. Okay. Okay. Okay.
Nothing outside these topics and nothing new will come. Only 1 or 2 questions. They add every year, they add 1 or 2 questions. And most of these questions, if you have done and if you are in the training, and if you have read the topics in a good way, you can easily answer
Yeah.
those questions. So nothing to worry
Okay.
about that.
Okay.
And the next one is critical care and surgical sciences.
Yeah.
Similarly, as I told you in the
Okay.
pathology session, there are like 34 or 36 topics, and these are the whole topics that come from. There are three stations of the critical care. There are trauma. You can see from, if starting from the start, you can see that there are like 7 or 8 topics from the trauma.
Yeah.
Polytrauma, trauma with a pelvic fracture, EDH. All these are, and the topics are very beautiful topics. If you are doing the residency or training, you'll get to know that these are very interesting topics, like obstructive jaundice, like gastric outlet obstruction, like acute pancreatitis. These
Yeah.
are very good topics and very easy to remember. I think the most easiest and the most interesting part is the critical care,
Agreed. I
because you
agree.
get to know you get to know the pain management, you get to know the post-operative fluid management, nutrition. We all know, we have read these things and we have read it very interestingly.
True.
So if similarly, as I repeated, that as in the pathology, if you carefully schedule these on daily basis, 3 or 4 topics, you can easily end the whole critical care portion within 10 days, and then you can again repeat it. And
Okay.
similarly, they will give you a scenario, and when you will enter into the exam, there will be a set of 10 or 12 or 15 questions they will ask you regarding these questions. I will there is a slide where I will a little bit about the marking criteria also. So let's move on to that, right?
Yes.
Okay. So this is the portion that I'm interested and I'm assigned to. So I have to tell you mostly about the skills portion. There are 9 stations. There will be 2 history stations. There are 2 surgical skills procedure stations. There are 3 physical examination stations, and there are 2 communication stations. As I told you that it's not like there will be 2 consecutive history stations. It's possible that in the first half, you have already done a history station, and in another half, you go toward another history station. Similarly, the procedure stations, similarly, the physical examination stations, similarly, the communication stations. So we will talk a little bit about each one of them, how to attempt them, and what is the data, or what are the most important topics of these four. So let's move on, guys. So the history is one of the interesting and one of the important thing, because we are here, we are practicing we are working here, we have studied from here, we are desi people. So usually history and communication is a little bit tricky for us, uh, because because of the language barrier also, but regarding other things also, like how to attempt the history station, how to attempt the communication station is very important. Basically, it's not like they want you to go toward a diagnosis. They want to see how do you treat the other person, the patient or the attendant. How do you take the history from them? Let me tell you a little bit about the stations that I attempted during my exams. Like, there was a patient uh, with the knee pain. Similarly, there was another patient with abdominal pain, and there was one with urinary retention. Basically, that was BPH. So these are the important topics. Usually, uh, these are the whole topics. No patient or no history will come outside these topics, but you have to attempt them in a very good way, in a very good manner. As I told you that during my exam there was a patient with a knee pain, and he was not he was always, the patient will be actor. There are no real patient. Always the other one will be an actor. So they also don't know a lot about the scenario. So they have told them regarding these questions and answers, and when you will go, you will ask them those questions. And but the main important thing is that how you introduce yourself, how you take the history, how you take each symptom, how you move toward the diagnosis, and afterward you present your case. As I told you before, that there will be 1 minute, there will be clear instructions in that 1 minute. You will get to know that I have a knee pain patient, or I have a patient with bleeding per rectum, or I have a patient with dementia, or I have a patient with chest pain. When you will enter, you will introduce yourself, you will take consent from the patient, then you will start toward the taking the history slowly. And then, as I told you, that my patient with the knee pain, he was telling me a lot that I have knee pain, I have knee pain. So I had to ask him in the start that, do you want me to give you some analgesia, painkiller, or is it okay? We can continue with the history. And he told me that, okay, we can continue with the history. So that's also one of the, because the actors, they have told the actors already that how they will be acting, and that is how they mark us. So these are the important topics. And as you can see that I think they make like 20 or 22 20 or 22 topics of the history. And if you plan them within 10 or within 8 days, you can complete the history sessions also. So there are few important things that you have to note regarding the history. As I told you before, that the tone, the tone, the selection of the words, uh, be empathetic, all matters a lot in history and in communication station, in both of them. But they will give you 1 minute to read the instructions. There will be 9 minutes within the station. But in the station, in 6 minutes, you have to complete your history. Because if you do not complete your history, you are not going to present it timely. And if you do not present it timely, there will be no time to answer the questions. And if you do not answer the questions, then technically they will not mark you, because they are going to mark you regarding the questions. They have a set of questions. So that's why uh, practicing the history, practicing the communication, practicing the surgical skills is very, very important. And you have to time yourself. You have to time yourself within the 5 or 6 minutes, that I have to complete my history within 5 minutes, within 6 minutes. And when you will start practicing it, it's very easy. In start, it will be very difficult for you to complete the chest pain within 6 minutes or knee pain within 6 minutes. But when you will practice a lot, 3 times, 4 times, then it will become very easy. Are we okay?
Yes, Dr. Jamal, I had two questions. One was, you said we
Yeah,
have to
yeah.
finish the history in 6 minutes. I agree with that. We have to finish history in 6 minutes. But I was told that they ring the bell at 6 minutes, and then you're not allowed to ask any more questions, and they start asking questions after this. After that, in the next 3 minutes. Is that right?
Yeah, exactly. That is right. But as I told you that there will be two examiners. One will be a surgeon or a doctor examiner, but the other one will be a layman examiner. So
Okay.
basically, both of them uh, are marking you on different things. The one is marking you regarding the symptoms and regarding the diagnosis, but the other one is marking you regarding the empathy, regarding the other things. That are you empathetic with the patient? Are you
Okay.
taking care of all the things that
Yeah.
the patient need? Uh, and so if you do not complete it in 6 minutes, then they are not going to mark all the ticks.
Okay.
Are you getting me?
Yeah.
Yeah.
Yeah. Yeah.
Yeah, after 6 minutes, they are going to ask you that present the case or the questions and answers. But if you have not completed it in 6 minutes, then believe me, technically you will have that burden on your mind that I haven't completed it. But once you complete it within 6 minutes, you will be much confident, and you will answer all the questions, and you'll make them tick all the boxes. Okay?
And do we get a minute or a few seconds, maybe 5, 10 seconds, to just compile our history and before we start presenting it, or we start
Yeah,
presenting it
yeah, yeah.
immediately?
They will give you. There will be a pen. There will be you can basically let me tell you that what happened was that my patient with the urinary retention, I went there
Yeah.
and I asked him. I introduced myself and I asked his name and age, and I confirmed the name and age. And at the end of the history, I forget the name. I
Yeah.
didn't write
Yeah.
it,
That is
so I
very good.
forgot the name. I forgot the name. And like I was so much worried, but I said that my patient, 35-year-old male, presented with these things. So
Yeah.
I hope that they won't ask me, and usually they don't ask you. They
Yeah.
don't ask you because there is a very little bit time and you have to answer the question. So it's a very quick thing. But again, as I said you that with the practice, you will get to know that what you have to take care of, what data you have to take, what you have to write, so that you can
Yeah.
compile it in seconds and present
Yeah.
it in seconds.
Yeah.
Again, the practice is very important in all these things.
Yeah,
There
true.
are few
Well, it
histories.
brings me to my second question, which brings me to my second question. Maybe we can discuss this later as well. It was regarding the its portion in the dementia portion in history taking. I am very confused regarding what are we supposed to do. Are we supposed to do the MMSC, the minimal mental state examination, or we are supposed to stick to the AMTS examination,
Well,
history taking? Because MMSC takes a lot of time. It's 11 questions, and to explain the question and get the results and then interpret it, this MMSC score. I don't think it is possible in 6 minutes per se. What do you think?
Hassan, you are correct. Mm. That's the problem that every candidate faces.
Yeah.
Honestly, in my exam there was no history from the dementia, and I think as I have revised the recalls, dementia or preoperative confusion comes very less likely
True.
because they already know it. But
Hmm.
if it comes, but if it comes, I personally think that the mini mental state give you the idea about the status of the dementia, of the confusion. So that's, if you can do that correctly within the time frame, that's more than enough. You can present your case, you can tell about all the questions, you can answer all the questions. But once
Yeah.
we are into the
I was.
history, yeah, yeah.
Yes. 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 I was under. I basically I
But
had
once
this
we are into the
mental thing prepared that I could go with the AMTS, the abbreviated mental test scoring, and then once the time is up, probably if the time is up, I could definitely tell the examiner that, "Sir, I would also like to complete the MMSC examination to rule out this. If I don't have time, but if I have time and the score comes to be less than
exactly.
six, then I could proceed with MMSC rather than directly going for the MMSC examination."
That is the correct way. That is the correct way, and the examiners also know it. They are not there to trick you or to fail you. Believe me,
True. Yeah.
most of the examiners are so helpful. There will be a smile on their faces. They will, like you will find a positive energy within the station. It's not like the desi the desi stations or the desi
हमारे एफसीपीएस
environment
वाले
of
नहीं
the
होते ना,
exam. It's
हमारे
very
एफसीपीएस एग्जामिनर्स की तरह नहीं
it
है.
is a very exactly. It is very they make such a good environment for the candidates, believe me. And they
Okay,
they try they try that you pass the exam. So
true.
the dementia, confusion, and similarly as I was telling you that there are few stations that are tricky stations like dementia, like depression,
Mm.
like asking the question regarding the impotence and these things.
Mm.
But they do come. You have to make yourself prepare. Like
True.
similarly, within the surgical procedures, there will come some procedures that are difficult to do within 6 minutes or 8 9 minutes. But you have to prepare yourself. You have to
Yeah.
prepare for the worst. Sometimes they do come, but most of the time they don't come. Most of the time there will be very straightforward history. There will be very straightforward communication sessions. There will be like
Mm.
back pain. There will be like knee pain. There will be like chest pain. Most of the time, but you have to prepare yourself for all of these. So let's
Okay.
move on toward our next
Yes.
topic, That will be the
Physically.
physical examination. Three stations within the skill portion. This is the physical examination has more stations. Like three stations will come from for the physical examination. There are a lot of uh, examinations in regarding the orthopedic portion, like knee, hip, ankle, shoulder, hand, spine, foot drop. Most of these come from the orthopedic portion. Similarly,
Mm.
some comes from the general surgery portion also, like abdominal examination,
Yeah.
thyroid examination, parotid gland examination. But there are few stations, few topics within the physical examination that repeats a lot. Like abdominal examination repeats a lot, like thyroid repeats a lot, parotid repeats a lot,
Mm.
submandibular gland repeats a lot.
Mm.
But the shoulder can come, head examination can come, foot drop can come. Similarly,
Mm.
the cardiovascular, respiratory, cranial nerve examination, cerebellar examination, varicose vein examination, similarly, the
Mm.
inguinoscrotal lump examination,
Yeah.
anything can come within these topics. But mostly abdominal, the favorite ones are abdominal examination, uh, the varicose vein
Direct
examination,
breast.
thyroid, parotid examination. These are the hot topics that usually repeats again and again, again and again. Similarly, the hand examination, it is very easy and very good, and it also repeats a lot. Again, I will say that uh, a lot of data, because once you will start doing the examination, you will get to know that you have to repeat it a lot. You have to
True.
make it like a habit to end it within the 6 minutes or within the 7 minutes.
Yeah. Yeah.
So practice is the key. You will have to practice this again and again. As you will enter into the station, there will be clear instructions. They will tell you that yes, start your examination now. You have to examine the hand, you will have to examine the shoulder, or you have to examine the inguinoscrotal lump. But if you have already done it a lot of time, multiple times in your preparation duration, then you will not be hesitant. You will know that I need the exposure, and I have to ask the patient that I need the exposure, or I have to tell the instructor that I need a chaperone. And then you will start these things. Once you have done it multiple time, then they will be on your tips. Then it become very easy. The examination becomes very easy, and then your presentation become very easy. In my exam, there was an examination of the ankle, and when I entered into the station, there were clear instruction, as I have made a slide regarding that. And let's move on to that. Okay, what are the important steps for the examination? That when you enter, you introduce yourself, you wash the hand before touching the patient, and while washing your hand, or usually there is a sanitizer, while you are sanitizing your hand, you can introduce yourself, you can confirm the name of the patient and age of the patient, or any number of the patient, and then whatever you are going to do, you explain that procedure to the patient, and you ask for chaperone if it is a breast examination or inguinoscrotal examination, and you take a verbal consent from the patient. Yeah, is that okay? Is that okay with you? Can we continue? Uh, and after that, you ask for the exposure from the patient, and then you start doing your examination. And in each step, you have to guide the patient that I am going to do this. I am going to do this. Does it hurt? Do you have pain anywhere? So you have to be very empathetic. You have to be very considerate about these things. And in the end, as they said, don't forget to ask about existing pain before preparation. And if what I wanted to tell you was, this was my station, one of my station. So the instructions were that 18-year-old soccer player sprained his ankle while playing on the ground. He was brought to the emergency with ankle swelling and pain. So when I entered the station, there was a young. He was sitting on the couch. He was sitting on the couch, and when I introduced myself, uh, I asked him regarding that I'm going to start the examination. And when I did my inspection, and after that, when I started to palpate him for the temperature and for the pain, he started shouting that it's painful, it's painful. So I asked him before, is it painful? He told me, yes, it is painful. Told him that I will be very gentle with you. But when I start touching him, he started shouting that it's very painful. So immediately I told my examiner that I would not continue the examination because it is very tender and patient. It's painful. So I would ask my staff to come up with a painkiller, and after that we can continue toward the investigation. So he told me okay, and he started asking me about the ligaments. He started asking me about the management, what investigation I will do, what painkiller I will do, I will give. So that was my whole station, believe me. And that station ended before the time. And I asked him that, are there any other questions that you want to ask me? He said no. I asked him that, is there any question that I can improve? He told me no. All the answers are okay. So
Yes.
this was my station. So what I wanted to tell you was that uh, you have to be considerate about all these scenarios and all these
Mm.
things, and practice a lot, practice a lot. We will try to uh, guide you regarding all these scenarios and try to guide you regarding the practice also, how to do these. And look, all of them are like 30 examinations. So
Mm.
again, as I told you, that if you make a very good schedule and do it on regular basis, 1 or 2 examination, then within 2 weeks you can complete the examinations. You can complete it for once, and then you can again plan it and again start doing it. Are we okay?
Yes, yes, yes. Thank you.
Hassan, you are mashallah very interactive. Thank you for that. But I want to
You're welcome.
also,
I have my exam in 2 months and I haven't done anything yet.
don't worry. You will ace it. So Ali,
Inshallah.
Muhammad, Shena, Somro, Mitali, are you guys there? Yeah, Mitali, okay. Thumbs up.
Yes,
Guys,
sir.
come on.
Yes.
Ali. Ali, Somro, are you guys there? So let's move on. So
Yes.
physical examination, and after that there is another important, and uh, as one of my colleague from the London, they told me that one of the difficult thing for you guys is communication, how to communicate. And believe me, that is so correct. We can do all the knowledge portion, we can do the examination, we can do procedure skills. Communication is very tricky. You have to give a very good amount of time to the communication. As I told you that usually in these kind of stations there are two examiners. One is the doctor or surgeon examiner, but the other one is that mark you regarding the layman terminology. They mark you regarding the empathy, how good you are with the person, how considerate you are with the person, with the patient or with the parent, and they mark you regarding that thing. So basically there are two stations. One station will be with the patient or with the relative of the patient or with the parent. That is one station. Usually you counsel them, or uh, you do the breaking bad news to them, or you are counseling them, or you are asking them, or there is any trouble and you are dealing with the patient or with the parent, right? That
Mm.
is one communication. And the other communication is that regarding your patient, you are talking to a consultant or a healthcare worker regarding your patient. You are usually referring your patient, or there is a scenario regarding that. We will discuss that. So there are two communication, but each one needs practice. Each one needs very good empathy. Each one needs very good tone, because that is how you pass the exam. Believe me, When you will start practicing these things, you will get to know that anatomy, I can do anatomy, pathology, and everything, but communication is tricky. So let's see what are the topics. Regarding the first station of the communication with the patient or with the parent, usually these are the 10 topics that comes. Either the patient will be self discharging himself or herself, either you will be taking consent for the endoscopy, either there will be anxious parent or there will be angry patient, or you will be counseling a patient before stopping warfarin. There will be, because those are the actors, they already know what to ask you, how to trick you. So you have to be very gentle and very clever in the communication. They will try to, they will make you angry, but that you have to deal with them. That is how they mark you. They see what your response will be. Either you will get angry or you will deal with them. And how will you deal with them? They mark you. The layman examiner will mark your tone also. How do you speak? How loud you are? How gentle you are? What terminology you are using? And the other one will be the surgeon or the doctor examiner will be mark you regarding the procedure or regarding the things that that you need to tell. So these are the 10 or 11 topics, the important topics, and usually it comes from them. In my case, there was the city machine was out of order, and it was an angry wife, so I had to deal with them. So basically, what happened was that when I entered into the station and I introduced myself, the wife started crying. So basically, you will have to uh, know take care of these things. She started crying, and there was a tissue box near me. So I handed over that tissue near her, and I told her that she can take one of that. And I started counseling. And after that, we started question and answering and counseling and everything over that. It was very good station. Similarly, like in a delay in the arthroscopy procedure, the patient is very angry. Similarly, in perforated appendix, the mother of the patient is very young. So all these things are in warfarin stopping before the surgery. The patient is very cunning, and they won't allow you. They will ask you a lot of questions, hell a lot of questions. So you have to answer all these very gently, with very cleverly. So basically, it also needs practice. And the other station is a phone call to the consultant, doctor, or healthcare worker. Usually you will enter into a station. There will be a file. You will read the file. You will make notes, and then you enter into another room. In another room will be a phone set. Uh, you will pick the phone, and there will be a consultant or healthcare worker, and you will talk to them. You will tell him that this is my name. I am working here, and I wanted to discuss a patient with you. And then you will start discussing the patient. He will start asking you answers, that okay, what about that? What about that? How are the labs? What have you done till so far? And like these questions. But they come from these seven scenarios. Nothing comes out of these seven scenarios. So it's very easy. If on daily basis you start doing one or two, then within a week you can easily complete the communication, and you can repeat it, and repeat it. So, is there any question? Do you want to ask anything regarding the communication?
No.
Hassan, have you already started communication?
Yes, I have done with communication already once or twice.
Uh-huh. Okay, very good, very good. Are you
Actually,
doing
my
it
scenario was
from your
different. I
own, or you?
actually I
Uh-huh.
I had booked my exam in last August from Pakistan. For my exam was supposed to be held in Abu Dhabi, but suddenly
Uh-huh.
Pakistani visas got cancelled and I could not go to Abu Dhabi, and I got a refund. And now I have moved to
Yeah.
England, and my exam is in May in Manchester now. But I haven't started preparing again
Mm.
yet. I prepared
Mhm.
that time,
That
but now I have
you have
again
very good
to. But I have
that
done
to
everything once at least.
yeah, yeah, that's perfect.
But
That's very
back
good.
in
That's
August,
very good.
not now. Back in August.
If you have already done it, then it will be very easy for you the second time in. So
I
don't worry.
hope so. I really hope so.
Yeah, yeah, yeah. Yeah. Okay. So we have the other topic is
The hospital
procedural skill.
procedures, lastly. Yeah.
There will be two stations regarding that.
Okay.
Uh, in my exam, the one of the station was ordering a theater list, and the other one was uh, that was suturing a wound. Yeah, it was that one. So these are the whole the complete topics that usually the stations come from. There will be you have to
Mm-hmm.
order a theater list. There will be an examiner. There will be names and procedure of the patients, and he will ask you that order the list. So there will be something. There will be a diabetic patient. There will be a kid. There will be an emergency
Mm-hmm.
surgery obstructed hernia, or there will be a patient with MRSA positive, or there will be something tricky, and they will ask you regarding that. Which patient you want to do first, which one you want to do the last, why you want to do it the last, why you want to do it at first. So you have to. It's very easy and very interesting one. Usually the cannulation of ATLS patient or HIV patient, it doesn't come, but you have to be very careful about that. In the recalls, we haven't seen it yet regarding the HIV patient or ATLS patient, but should know these things. Similarly, FNAC, very seldomly it comes. Debridement of the contaminated wound is very important because they see what you do there. They ask you a lot of questions. Suturing a wound is very important and comes very frequently. Tying a knot is important. Excision of a nevus is usually a little bit difficult, but it do come. Similarly, abscess drainage is a good one. Scrubbing, male catheterization, it is a when it needs very good efforts. Male catheterization, chest drain insertion, airway management, cannulation, and taking blood from HIV patient. They seldomly comes. I haven't seen them in the recent recalls, but
Mm-hmm.
you should know how to do that if they do come. So basically, uh, the two stations, and you have to know how to do all these things. In my case, the one was ordering the list, and other was, I think, it was suturing a wound. Basically, when I entered, so I introduced myself. There was a patient sitting, and he had a pad on his thigh, and usually that pad meant that it's a wound. The wound has been uh, scrubbed, and now it is a clean wound, and you have to suture the wound. And they will ask you, what do you need? So basically, what you have to do is that as you enter, you introduce yourself to the patient, you ask, you confirm the patient's name, and you take a consent, you guide him regarding the procedure, what will be you doing. After that, you move toward the your assistant, and you ask them to prepare a tray for you. And he will ask you, what do you need? There will be a lot of instrument. There will be a lot of sutures, and they will ask you what suture do you need and what instrument do you need, and they will give you in a kidney tray. And then usually there will be gloves. They will ask you what kind of gloves do you need, and you put that gloves on. And after that, usually the area is already scrubbed, but you have to ask, or you have to, or usually they will tell you that you have to anesthetize the area. So you will give local anesthesia, and they will see that how you are doing that. And they might ask you questions regarding the dosage of lignocaine or what other anesthesia medications are and how you are doing that and how are you treating your patient. You have to you have to guide your patient regarding each and every step. And uh, when you will be closing the wound, your patient will start asking you questions like what antibiotic will he need, when will I come again, when I will take out the stitches. So you have to answer these questions also. So within 9 minutes these things are hell a lot of. But if you are prepared and you have already in mind and you have practiced once or twice, then it becomes very easy for you. Otherwise, if it is the first time that you are doing these things within the exam, then it becomes very difficult for you. Similarly, the male catheterization, it is very like complex and extensive. You have to do all these things within 9 minutes. It becomes very difficult at that time. So the important steps for the procedural skills is that, as I already told you, you introduce yourself. You tell them that, hello, my name is Dr. Jamal. I'm one of the surgical doctors here. And you confirm the patient's name. Could you please confirm your name and date of birth, please? Could I check your name, please? Then you explain the procedure. Today I'm going to close the wound. And then will that be all right? Are you okay with that? And then you start seeing the important data. If you have to see the patient name from the file or side or procedure, that's the WHO checklist, or whether they can ask you what the WHO checklist is, but usually it's not the case. Then you prepare it, as I told you, they will usually trick you in that. What is that you need? What kind of suture do you need? Do you need Vicryl, Proline? What number do you need? What needle do you need? Then they will see that once you close the wound, what you do with the needle. There will be usually a sharp box, and you have to dispose it in that, and disposal and the patient instruction, and you have to complete the instruction. You have to tell them that after 7 days, daily you have to remove the bandage. You have to change the bandage, and after 7 days or 10 days, you will come, or you can go to your GP to remove the stitches. And this is the antibiotic. You have to use these antibiotics, and after that you will tell the instructors that I need to document the procedure. So all these things are part. In the last, there is a slide where I will discuss again about these things. As we said earlier, that each station is 20 marks, usually 10 minutes, 1 minute for the reading the stem, to take history from the patient, 3 minutes to present your case. Patient is always an actor, and usually two examiners are present in the history station. This is what I wanted to talk to you. Basically, the good thing about MRCS is that they do not fail you easily. They are not after a diagnosis, that you have to make a diagnosis. They are after the small steps that you take. Each step has marks. Have you washed or sanitized your hand or not? Have you introduced yourself or not? Have you taken consent from the patient? Have you confirmed the patient's name or not? Have you given instruction regarding the procedure or not? Have you asked about the allergy, any allergy or not? Have you checked that the area is anesthetized or not? Have all these small steps pass you or fail you. So it is not that you miss one thing and you will fail. No, it's not like that. You have to be very considerate, and you have to take care of these small steps, and you have to do all these steps to pass it, because that is how. This is one of the page from the examiner sides, that how they mark you. If you have washed your hand and introduced yourself and your role, then you will get 2 marks. If you have confirmed the patient name and establishes the rapport, or started with the open questions, you will get 2 marks. If you have asked regarding the patient complaints and history and presenting complaints, you will get 2 marks. And if you haven't done that, then you will get 0. And if you have asked regarding the past medical history, medication, allergy, you will easily get 2 marks. So that is how they mark you. It's not just one thing that you have done the diagnosis, or you haven't included one thing in the differential diagnosis, you will fail it. It's not like that. It's not like desi culture. So they have this sheet. That is how they mark you. So the
So
good thing about this is that, yeah.
Dr. Kumal, excuse me. So this means that even if we miss like 4 questions, and we have
Mhm.
I've gotten 2 marks in the previous 5 questions, we still passing the station by full marks. As in, if the every
Ex-
station is 10 marks, right?
yeah, exactly. and you need 70%. Basically, you have to pass the both separately. You have to pass the knowledge and you have to pass the skills.
Yeah, yeah, yeah.
But
No,
in both,
that I know. I was thinking about this. For example, this is one history station, and there
yeah,
it is out of 10 marks. 70% is
yeah,
somewhere around 7 or 8 marks, right? So if we
yeah,
do the
exactly.
first 5, 6 questions perfectly, we get 2 marks
Uh,
each
yeah,
in everything. So even if we don't, for some reason, we mess up all the rest of the station, we still pass the
yeah.
station with full marks.
Kind of.
Okay.
This is not the 100%, but I what this is the approximate way of how they do
Okay.
it.
We can still get
It's
five,
not that
seven marks at least.
yeah,
Yeah.
exactly. It might be that they just have 0 and 1 mark. They don't have 2 marks. Are you
Yeah,
getting me?
probably. Yeah,
Yeah.
I got it. I
So
got your
if
point now. I got your
yeah,
point.
so if they consider 1 mark for each, like washing your hand, introduce yourself and roll, but you have done only you haven't washed your hand or sanitized, but you have introduced yourself and your role,
Yeah.
then it's possible that you will get zero point 0.5 marks.
Yeah, yeah, I get
You will
it.
not get 1 mark.
So my point is, in a history station, do we have to wash hands in the history as well?
No, 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 no. It's not like that. But this is just for the practice. This is just for fun.
Okay, okay, okay.
You don't
Yes,
have
yes,
to.
yes. I get your point now. Yes. Okay,
In
okay, okay.
my exam, in when I went to the exam in Malaysia in Kuching, they
Hmm.
gave us in station where we had to wear the gloves or sanitized. They
Hmm.
outside the station when within the 1 minute when we were reading the instruction, they gave us the gloves so that we do not spend much time wearing the gloves inside the station. So they already gave us the
Oh,
gloves.
nice. Very nice. Okay.
So that was a good thing because when you enter the exam, then you get confused. Now you have to see where the gloves are. You have to wear the gloves. So we already wore the gloves outside the station, and we entered with that. So that was a good thing about that. As I told you, they try to make the environment very good for you. They try that you pass
Yeah.
the exam.
They facilitate you. Okay.
Even one of my colleague told me my colleague told me and that if basically most of my station, I noted that most of my station, I am closing my stations before the time. So
That is
30
actually very good.
seconds before the 30 seconds before the time or 1 second. So in one station I asked the examiner that
Hmm.
I have uh, I have closed it early. Is that all right? Do you want me? One of my friend told me that if you close the your station early, do ask the examiner that is there any question that you can improve. So I used that in especially in the anatomy station. I asked them that is there any. So they told me that do you want to repeat this question answer again? So I tried, but I was not
Hmm.
successful. But I do try it. I do try.
Yeah, that's very good, bro.
I did
Very
try.
nice.
I did try at that time. So that is how it is. As I said that explaining it in 1 hour is a little bit tricky, but usually so
Yeah.
these was so that was all about the exam, the real
Love.
exam scenario. So there are other tips. You have to be consistent in practicing as we did this. You are already familiarized with the exam structure. We do know how the exam is. You have to be very confident in the exam and do clearly communicate things. Similarly, in the techniques, in the skills, in the examination, you have to polish yourself. You have to do it again and again. It is
Hmm.
always better that you have a colleague or you have someone with whom you practice the things. And if it's 2 months away, then you cannot miss any day. You have to do something every day. You have to give 2, 3, 4 hours on daily basis. You have to practice on daily basis. You have to practice history. You have to practice communication. You have to practice examination. Similarly, you have to read anatomy, pathology, and critical care.
Dr.
You
Jamal, how
will
much
be
time do
doing
you think I would need on a daily basis? Honestly,
if well
I
well
am not
if you
working right
do
now. I am not working right now.
Hassan, 3 to 4 hour is more than enough. But 3 to 4 hour of a very good focus,
Seriously,
very
only three
good
to four
focus.
hours.
Yeah, if do I usually what I did was uh 3 months of preparation. We were like
Yeah.
3, 4 colleagues, and we really daily basis we would start at 9 and till 11 and a half or 12 we would do. But that was a very focused study. So you can give 4, 5 hours or 6 hours maybe, and that's more than enough. That's perfect.
Because I
So
have
what
only
are the
2 months and I'm
resources?
starting from scratch now. That was the main concern, primary concern.
But you do have a base now. You
Absolutely.
already know. So that's a good thing, now.
Yeah, I
That's a
have read
very
everything once. I have read everything once apart from the examination stuff. I am not, I haven't done the examinations yet. But apart from that, history, phone call, knowledge, anatomy, I have done those once at least.
that's very good. That will be very helpful for you. So basically, what we will be doing emed as a emed course provider, what we will be doing is that we will provide you with the data, we will provide you with the support that will be needed for the exam, a very comprehensive Part B courses, live interaction or OSCE practice, as I told you in this session.
Yeah,
We will try to be more interactive with you. We'll try to practice the stations with you. Try to provide you with the scenarios that how the exam is, how it's done, what errors are you making, what's remaining, what are the deficiencies. We will provide you with the recorded webinars, and we will give you a supportive study groups and mentors like me or like other colleagues of mine, and we will try
I
to
really need
take a
those. I
work.
really need those. I really need help to get past now. I got just 2 months now.
No, you will do it. You will do it, and we will also provide you with one-to-one mock exams.
Yeah,
Uh,
absolutely. Very
um,
important.
we will try to do it way before your exam so that we get enough time to do the improvement also.
Yeah, absolutely. Yeah, I agree. I agree. Because I was told the appearing in England is more difficult than appearing in Pakistan, Abu Dhabi, or somewhere. Like, because
That is
maybe
the
the standard over here is maybe different. They expect more because it's their own residents appearing over here. So the percentile is probably high here. I'm not sure. I was just told about this.
no that's true, Hassan. That's true. One of my colleague, when I went to the Malaysia, we were
Yeah.
basically we were basically 3 colleagues. We were preparing the exam. One was
Yeah.
from England. He was somewhere in Manchester or somewhere.
Yeah.
He had done orthopedic training from Pakistan, and he was
Mm-hmm.
there as a registrar.
All right.
And the other one was from Karachi,
Mhm.
and the third one was me. So when we went there, Malaysia, the guy told us that he had already attempted in UK, but it's very difficult doing in the UK, and so he failed the exam there.
Exactly.
So now he came to Malaysia, and what we were, uh, like, what should I say? And not envious. We can say envious that we thought that his English is very good because he's working there in UK, and we were
Yeah,
having a
absolutely.
lot of difficulty in communication and his
True.
in these kind of things. So he told us the same thing. He said that in UK the exams are a little bit tricky and difficult. So,
Yeah.
but Hassan, you have to be very resilient in these kind of exams. As I told you earlier, that when you will enter into the station, you will see that the adrenaline rush, the stress, the level of everything. And
Yeah.
if God forbidden, one of your station doesn't go well, then the
Mm.
stress increases more. That affect your next station. So you have to be very, while preparing for the exam, you also have to keep that in mind, that if
True.
that happens in the exam, how you have to
Mhm.
manage another one. You cannot, if one station doesn't go well, you cannot you cannot let that make your other station bad, or make you fail the other stations. So that is how you have to be very careful about that, and that is how where we will try to help you. We'll try to make you stay focused, and we'll try to tell you about the exam pressures, how to handle that effectively.
Yeah.
So, so this was all today's today's session was all these things. I hope we tried to give you a very good review of the exam and insight of the
Absolutely.
exam. I hope that I was successful in doing that. If there
Very,
is
very good.
any question from your side, Hassan, it was very very interactive with you, boy.
No, it was lovely talking to you, Dr.
It
Jamal.
was
It was
very
lovely
interactive
talking to
with
you, and it
you.
was very helpful and very knowledgeable. And I really look forward to your
Uh-huh.
mentoring and your guidance every step of the way. I've logged exactly 2 months now, so I'll be needing your constant support and guidance now.
Yeah, yeah, why not? Why not? We are here as a EMED masters. We are here. We will be helping you.
Thank you very much.
Our host Sarah, she will be communicating all the things with you, and we will give you guys the schedule how to do this. As I told you that we will make you a very good and very practical schedule, how to complete
Yeah,
these
that's
things
why I'm saying I
multiple
needed a
times.
schedule like, yeah, I needed a 2 month schedule, something which was practical and which was actually effective, not a generalized schedule.
Yeah,
Because
yeah, yeah. I can understand.
In
I
May,
can.
probably 23rd to 27th May, any day I'm going to get my date in one of these days
Hassan,
in
I went
Manchester.
through all these. I went through all this has all this thing. So don't worry. So we'll try to make a very good schedule for you, and
Perfect.
you will pass it very easily. So
Inshallah. Inshallah.
any other guys, Ali, Somro, any other question or any other thing? Guys, are you there? I think they must be working along with that. So Hassan, we will stay in touch. Sarah will stay in touch with you guys, and she will provide you um, with the schedule. And
Yeah,
Ali
sure.
and Somro, do inform us regarding your exam, if you have already booked the exam or not, or if you need our help regarding the exam, you can
Yeah.
write us.
Yeah.
So
And
Hassan,
I'll be in
anything
touch with
else?
Sarah, and I'll ask her to just give me a schedule as soon as possible.
Yeah, I think Sarah was working on that, and she must have already made the schedule. Within a couple of days, she will give you the schedule, and then we will start working on that. Anyways,
Yeah,
the
that
Sarah,
would be
you
great.
can.
That would be great because Dr. Jamal, I need to get my GMC to start working here. I have moved to England now. My wife's working here, so but
Mhm.
I need my GMC now. I have talked to the hospital and they're just waiting for my license, and then they're willing to give me a job. But I need my GMC now.
Yeah, yeah, yeah. You will get
Yeah,
that. You will get that. Don't.
yeah.
These are the
I'm a
standards.
urologist by
These
profession.
are the.
I was an FCPS urology back
You
in
are
Pakistan. FCPS urology.
urology. Oh,
Yeah,
that's a very good field. Yeah.
yeah, I love it.
So that also very helpful. If you have already done the training, then it becomes very helpful for you, that you know the general surgery procedures, you know the urology procedures,
Yeah,
it will be very easy for you to attempt urology histories and all these things.
yeah.
So it will become very easy for you, much easier
Hope,
for you, and 2 months
hopefully Allah
a very
better
good
करे.
time. So don't worry
Allah
about
करे,
it,
Allah करे.
but you
Inshallah.
have to start it. You don't have much time to waste it again.
Yeah, true.
Hassan, that
True.
okay?
Yeah, absolutely. Absolutely. I'm on it.
so
I'm on
so
it. I'm
so
on it.
let So let's move toward the closing of the session.
Okay.
I hope it was helpful, and we'll stay in touch, inshallah.
Yeah, definitely. Definitely. Thank you very much, Dr.
Okay,
Jamal.
Hassan.
Thank you.
Okay, okay, okay.
Okay. Allah Hafiz. Allah Hafiz. Bye bye. Thank you.
So let's resume it.